I would knock on the door and walk in the patient's room. I would introduce myself. My name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing, and I'm going to be inserting an IV today. I would check the patient's orders to see that I'm inserting a saline lock in the morning for a CT scan. I would check my hospital policies, and then I would perform hand hygiene and check my patient identifiers. I would see this is Mr. Jaguar Jones, with a medical record number 417-6352, 417-6352. I would assess the patient for any allergies and see that he's allergic to penicillin and it matches his chart for penicillin. I would next position my trash can, perform hand hygiene, and put my goggles on. Next, I'm going to position the patient's bed. I'm going to raise it to a comfortable working height, lower the bed rails, and then I'm going to provide my patient with privacy and gather all my equipment. I'm going to open my packages. I'm going to open up all my packages. Be ensured to remain sterile technique. I'm going to place a protective barrier under the patient's arm, just in case there's any leakage. I'm going to prepare my tape. I already have some tape prepared, and I'm going to open my transparent dressing. So next, I would take an alcohol swab and I would swab the cap. I would loosen the cap and then I would attach my flush syringe. I would prime the tubing. And then I would just place it back down. Next, I'm going to choose a vein, and to choose a vein, you would want to choose a vein that is a distal vein. You would want to choose a bouncy, spongy, large vein, and you would want to also choose a vein in the non-dominant arm. For fostering the vein, you could apply warmth to the patient's arm or to the site. For vasodilation, you could place the arm in a low position, a dependent position. You can get the patient to clench their fist, or you can stroke the patient's vein. So next, I'm going to apply the tourniquet 4 to 6 inches above the insertion site. I will check the patient for a radial pulse, and I'm going to apply my clean gloves. Next, I'm going to use ChloroPrep to clean the injection site. I would clean for 30 seconds, and I would do this in a horizontal, vertical, and circular motion. I'll be applying friction to the site. I would allow the site to completely dry, and I would remove my over needle catheter. I would open it. I would anchor my vein 1.5 to 2 inches below, and I would be sure not to touch the site that I had just cleaned, and I would also not touch the catheter of the needle to my glove. I would insert the needle at a 30-degree angle, and I would insert until I'm at blood return, and then I would lower the needle and insert another 1/4 of an inch, and then insert all the way to the hubcap. I would secure the cap. I would release the tourniquet, with the other hand. I would apply pressure 1 1/4 inch above the insertion site, and I would remove the needle. If I had a sharps container nearby, I would place the needle in my sharps container, and I would attach my saline lock to the catheter. I would then secure with a piece of tape. I would aspirate for blood return, and then I would flush the tubing with the remainder of my saline. I would then uncap the saline, throw it away, and then I would take my transparent dressing and I would be sure to only cover the insertion site and the hub, not touching my fingers underneath the site any. I would then remove and just secure the dressing. I would secure the remainder of the tubing. I would place the label onto the dressing with the time, date, my initials, and also the gauge of the needle. I would dispose of all my equipment. I would lower the patient's bed to the comfortable position. I would raise the side rails. I would, when I was throwing away all of my things, I would be sure to remove everything from my patient. I would remove my gloves, glove to glove, and skin to skin, disposing of them. I would then teach the patient about infection signs of the IV. I would teach them any signs of phlebitis, infection, or any swelling. I would instruct the patient to inform me if there was any leakage from the IV or if there was any blood return into the tubing or under the dressing. And I would also instruct the patient to wrap the IV site for a shower, and also to secure the tubing when moving, and also to use the arm as little as possible. I would then go back to the nurse's station, and I would document the date, the time, the location of the needle, and which arm it was placed in. I would document the flow rate, the saline lock. I would document the number of attempts and the method of infusion. So next, I will demonstrate removing the IV. So I would be sure to have a 2x2 gauze, a piece of tape prepared already, and also I would have the protective barrier under the patient's arm again, apply clean gloves, I would remove the dressing from the outside to the inside. I would place my 2x2 gauze over the insertion needle. I would remove my tape. If the patient was receiving any type of infusion of saline or medication, I would be sure to discontinue the infusion. And then to remove it, I would pull back, parallel to the skin at a steady rate and just remove the catheter. I would assess the catheter for any damage to see the intactness of the catheter, and I would dispose of the catheter into my sharps container. If a patient was on any anticoagulation medications, you would want to sit here and hold this for 5 to 10 minutes. Otherwise, you can hold pressure and then apply the tape. And then dispose of the drape and remove your gloves, glove to glove, skin to skin. Be sure all of your equipment was thrown away. You would lower the patient's bed to a low position. You would raise the side rails back up, assist the patient to a comfortable position, make sure their call light and all personal items were within reach, and then you would go back to the nurse's station and document the removal.